Welcome back. Thank you for staying with us this far. We now move on to the next segment, and this is our health segment, as we always do it every Tuesday. And we welcome you to be part of this conversation. Talk to us. Let us know where you're watching us from. Send in your questions or comments, or even if you're just seeking clarification, you are absolutely welcome to do so. Use the hashtag Good Morning Kenya on Twitter. Our official station handle ever remains to be at KBC Channel 1. My handle is at Jain Wambui. So today we're going to be talking about the universal health cover. This is a project that the government of Kenya has been on since 2013, when it was first initiated with the Linda Mama initiative. And today we are seeing, just last week actually, on the 7th of February, we did see the president roll out the national or rather launch the national rollout of the universal health cover. But what really does it entail? What can you and I, as a Kenyan citizen, expect from the UHC? To help us with this conversation today, we have two gentlemen. To my extreme right, we have Dr. Andrew Mulwa, who is the Director of Medical Services in charge of preventive and promotive health under the Ministry of Health. Good morning and welcome.
Good morning, thank you very much.
All right, and next to him, we have Gilbert Osoro, who is the manager in charge of Universal Health Scheme under NHIF. Good morning and welcome.
Good morning and thank you.
Thank you for being with us today, gentlemen. So again, welcome. We welcome your questions in regards to UHC, NHIF, in line with this conversation. So let me start with you, Gilbert. You know, we've had you before, but in line, whenever we talk about UHC, NHIF is right at the center of this conversation. So let us take a step back and understand the mandate of NHIF.
Thank you, Jane, and welcome viewers back at home. As you are aware, NHIF is a state parastatal, and it was established back in 1966. If you allow me, they say that the farther you look into the past, the farther you see into the future. I want to take Kenyans through a throwback so that they know the UHC journey. Even as we talk about UHC, yes, we've come of age. In 1965, the then government tabled the secessional paper number 10 that proposed the establishment of universal health coverage in this country. In 1966, the then Legislative Assembly passed Cap 255 laws of Kenya that established NHIF as we know it. From 1966, then when it was passed, the key mandate of NHIF was to pay for healthcare expenses incurred by people then in the formal sector. And the eligibility criterion then, that anybody that was employed and earning more than 10 shillings, more than 1,000 shillings, was to contribute 10 shillings as premiums towards NHIF. Yes. And the only benefit package then that was accessible to the members was inpatient treatment. In 1972, there was a major amendment to the Act, whereby the Act was revised to provide for membership to the members in the informal sector. And when I say informal sector, I'm talking about Juakali artisans, farmers, people who are self-employed. They also had access, whereby they were paying 20 shillings to be members of NHIF. Now, in 1998, the NHIF Cap 255 was repealed then by the then Minister of Health through Parliament, Honorable Mwai Kibaki, and in its place, we had the NHIF Act number 9 of 1998 that established NHIF as a state parastatal. And the key mandate then was that it was to provide healthcare insurance cover to both Kenyans in the formal and informal sector. And remember, from 1966, the only benefit package that was available to Kenyans was inpatient treatment. Sometimes when I meet people, they tell me that NHIF ilikuwa inalipia kitanda tu. Now, in 2012, the government then decided to procure a comprehensive medical cover for civil servants and members of the disciplined forces. That marked the beginning of NHIF administering what we call enhanced schemes that provided for comprehensive cover for the cohorts of civil servants and members of the disciplined forces. The other key amendment that happened to NHIF was in 2015, whereby there was a revision of the rates for a very long time, from 1998 up to 2015, the rates were fixated. Basically, members in formal employment were remitting 320 shillings, and members in self-employed were remitting 160 shillings. So that particular act was repealed, and in place, the rates were revised and capped at 3% of the gross salary and capped at 1,700 shillings. But I want to tell Kenyans that there were major changes then, because the increased premiums facilitated increase in the scope of cover, whereby in 2015, there was the rollout of new benefit packages. And it also was a turning point whereby the government had rolled out some new flagship programs. We are talking of health insurance subsidy schemes, that is orphans and vulnerable children, Linda Mama, older persons, and others. As I indicated, there was a new benefit package. We rolled out the outpatient benefit package for members of the informal sector. It also witnessed the introduction of rehabilitation for drug and substance abuse for people who are ailing from mental illness, and the mother and child, what is popularly known as the maternity benefit package. Yeah. Now, in 2018, as I conclude on the UHC journey, the then minister appointed the Health Finance Report Expert Panel, popularly known as HEFREP, to engage the public to see the changes that could be made to the NHIF to align it with the universal health coverage, and they came up with a report which was known as the NHIF We Want, that recommended 55 changes to NHIF. Now, in 2020, there was the UHC scale-up that was driven by NHIF. Remember, from 2018, we had the UHC pilot that was carried out in the 4 counties. Yeah, I want to rest it there before we embark on where the rubber meets the road, that is UHC.
Beautiful. That is a very beautiful breakdown of the journey so far. Now, let me come to you, Dr. Andrew. You know, given you are the director in charge of medical service when it comes to preventive and promotive health under the ministry, tell us a bit about what your department covers before we come to the conversation around UHC.
Thank you very much. I think to begin with, one, we all recognize that the functions of health in the Republic of Kenya are shared between the two levels of government, yes, where the Ministry of Health essentially does policy, national referral, capacity building of counties, and emergency response. Then the county government are tasked with the operational implementation of national government policies and running of county hospitals and health facilities, including primary health care. At the Ministry of Health, Directorate of Medical Services, Preventive and Promotive Health, first is charged with the responsibility of one, running the various programs, including the NCDs, cancer, tobacco control, accidents and injuries, and also tasked with running the strategic public health programs, which are the HIV, TB, malaria, yes, vaccination programs. Then we also charged with family health, where we have reproductive health, nutrition, we have adolescent and young people's health, we have child health, and we also have the primary health care, which is now where preventive and promotive health, where health promotion, primary health, community health services, and family health are domiciled. So in other words, because at the national level, we do one, preventive and promotive health policies, capacity build the counties in these policies, and enable the counties, and that is where we work very, very closely with the counties in terms of implementation of UHC, yes, because the model that Kenya has adopted for implementation of UHC will rely on primary health care. And primary health care will mean establishment of what we call primary health care networks that will involve the community level, which is level 1 health facilities, level 2 and level 3 facilities working, yes, as POCs for a hub, which is now level 4 hospital. So we are re-engineering the structure of delivery of health in this country in order to achieve UHC.
Now, UHC is a term that, you know, almost every citizen can associate with the Jubilee administration being part of their Big Four agenda. But in very simple terms, when you talk about UHC, what exactly are we, and what are we talking about? What does it entail?
Let me start by saying first, there are a lot of misunderstandings about UHC and what it means.
Yes.
Does it mean universal health coverage? Does it mean universal health care? Universal health care is not universal health coverage. UHC is universal health coverage. What in simple means, it means citizens or populations are able to access health services in the right quality, in the right quantity, in the right place, when they need it, without incurring hardship, financial hardship while accessing it.
Quality, quantity, access, and financial ease.
Yes, and population. So I've started with population is able to access health services in the right quantity and quality when they need it, so timely, and without incurring financial hardship. What essentially that means is UHC is not free healthcare.
Yes.
Because someone must meet the costs, and UHC is not any healthcare. UHC is health that is timely, that I want a surgery. I want it now and not next year. I want a service, a CT scan, an MRI. I want it now and not next week. So must
because
be timely.
It's not available.
Yes.
Okay.
So must be timely and must be in the right quality, so that it is not just any health that you access. The quality must be highest attainable standard of health or quality of health as enshrined in the Constitution of Kenya, Article 43. Then the population, you ask yourself, who are the people who are able to access these services? When you talk about Linda Mama, for example, is a UHC program.
Yes.
Targeting expectant women and postpartum, immediate postpartum period, where expectant women going through pregnancy and immediately after delivery are able to access health services in health facilities of good quality without incurring financial expense. So UHC means three facets: a population, a range of services that are available, and cost protection.
Now, what is the goal of UHC? Looking at all those factors that you have mentioned right there, the population, the financial burden that is involved in this particular case when it comes to delivery of health services.
UHC is meant to, and studies have shown that in this country, a huge population is impoverished by access to health. Today, you may be doing well, very senior officers, very senior people in the society, and especially the vulnerable. You may be doing well, but when you fall sick, you are admitted in an hospital, you require an emergency surgery that requires hundreds of thousands or 100,000 or even 30,000 shillings, and you can't afford it, then the family first is affected because they have to sell their cow, they have to sell their land, they have to disrupt their household income.
Yes.
So that after your illness, you go back to a poorer family than when you fell sick. That's the bottom line. So UHC is to ensure that whenever I fall sick, I am able to access services without getting poorer than I was before I got sick. So, and many families, I think our study done in 2018 was showing close to about 22% of families that get impoverished are actually as a result of health costs.
That's actually a fact. So many families are one medical bill away from poverty.
That is exactly what UHC is trying to address, so that we have our Kenyan population, and that is the vision of the president, that Kenyan population is able to access health services without having to worry about the cost. So the best way to achieve UHC, if I am a multi-billionaire, I do not need insurance, because whatever expense that I have for health, I can be able to afford it.
Yeah.
So if I have 1 trillion shillings in my account, and I fall sick and the bill is 200 million and I'm able to afford it, I probably do not need health insurance.
Yes.
But how many Kenyans are able to see that? So the principle of now pooling resources comes in, where everyone is required to pool resources. As a country, we put resources in one basket, so that from this basket, all of us are able to access health from that basket without impoverishing our pockets.
All right. Now that brings in all the other stakeholders that have a role to play when it comes to the delivery of UHC as a whole. The national government, the county governments, the private sector also has a role to play in this. But in this particular case, the government chose to partner up with NHIF to be the primary channel for delivering UHC. Before I come to you, Gilbert, from where you sit, under the ministry, why is this important for Kenyans to understand that NHIF is vital to this delivery process?
NHIF, one, is a government agency and a strategic purchaser of health, where you buy your health, put in one basket called the National Health Insurance Fund now. Previously used to be Hospital Insurance Fund. Now put the resources in that basket. Then from that basket, we can all access. It is a strategic government organ that can pool resources. And that is the principle that NHIF from 1966 that he has ably narrated to us, the journey. NHIF has been a strategic purchaser of health. So naturally, this would be the best institution for pooling resources in the government circles. So what NHIF is doing is we are using NHIF to pool resources. Remember, there are private companies that and private persons that are also paying NHIF.
Yes.
There are public organizations that are also paying NHIF. There are civil society organizations that are also paying NHIF for people. There are international development agencies that are paying NHIF. So in other words, what NHIF is doing is the official basket, for lack of a better word, is the government basket where all the resources are being pooled, so that the service providers, now whether private, public or faith-based, are now able to get resources from that basket and provide health services, and the citizen is able to enjoy the services being covered by the National Health Insurance Fund.
All right. Also, Gilbert, just looking at the same aspect, we've heard from the ministry, but also looking at NHIF in line with the delivery or just ensuring that every Kenyan has access to the UHC. Why is this partnership very vital for Kenyans to understand, first of all, before we even move on to what is entailed?
Thank you, Jain, and thank you, viewers back at home. I want to echo the words of what Dr. Mulwa said. Remember that NHIF's mission is to contribute towards attainment of universal health coverage in provision of affordable, accessible, sustainable and quality healthcare insurance through strategic resource pooling and strategic purchasing of healthcare services in collaboration with our stakeholders. And as indicated by Dr. Mulwa, NHIF comes with a rich history when it comes to provision of health insurance coverage in this country. And NHIF is the largest provider of health insurance services in Kenya. And based on that, being a state agency, remember, the agenda of UHC is not only a national government agenda, it's an international agenda. The United Nations passed a resolution on sustainable development goals, in particular SDG resolution number 3.8, that spelled that all countries in the world should aspire to have universal health coverage by the year 2030. And towards that end, the government, as part of its mandate in the global family, has domiciled UHC in our country. And His Excellency, the President, during his second term, promised Kenyans 100% attainment of UHC before the year 2022. And that's where we find ourselves. Now, for me, I want to tell Kenyans that health is wealth. It is a civic duty for all Kenyans to have healthcare coverage, because no one knows when illness will strike. But when illness strikes, what do you do? Because as Mulwa said, millions of Kenyans fall into financial hardships because they're impoverished because of trying to meet the cost of medical bills. As I speak today, I'm in about 10 WhatsApp group where we are raising funds for people who are either detained in hospital or are waiting for funds to be able to cater for their medical bills. But the good news is that with NHIF as your trusted partner, we can be able to assist you in meeting your medical bills. And towards that, NHIF and the UHC benefit package provides for 10 benefit packages that Kenyans are entitled to.
Now, we'll be coming to those benefit packages in just a bit to just even help our viewers understand what is really entailed when it comes to the coverage of UHC. Now, I ask this, why NHIF? Due to, of course, we have seen people uproar on social media, concerns around the reputational challenges that we have all seen NHIF experiencing and questioning the capacity to deliver UHC.
Very important, and we take note of the issues that Kenyans have raised.
Yes.
But I want to tell Kenyans that NHIF is the largest insurance firm, and when I say so, we have 156 points of service which are spread across the 47 counties. We have 70 branch offices, full-fledged branch offices, in all the 47 counties. We have 53 what I call satellite offices that are also found in the sub-counties. And we also have 53 points of service at Huduma Center.
Okay.
Apart from that, we have connectivity across all service points, all the 156 service points that are spread across the country. So even if you're in Kitui, you can be able to access the benefit packages that are administered by NHIF across the country. The other thing, we come with a legacy. Remember, from 1966, around about 58 years, we have been in this business of healthcare insurance and serving wananchi, irrespective of their status. The other bit, we have a highly qualified personnel. We have employed medics, clinical officers, and others who undertake due diligence, pre-authorization, and others. We have the largest network of healthcare providers, and when I speak the largest network, we are looking in excess of 7,666 healthcare providers that are empaneled and contracted by NHIF. And these contractors span across board. We have the government facilities, which constitute 75% of the healthcare providers that are empaneled with NHIF. We are looking at a figure of 5,800 HCPs. We have faith-based institutions, and finally, private healthcare providers.
Okay.
Thirdly, we have been increasing our scope of cover, and I want Kenyans to look at the journey that NHIF has gone. I mentioned earlier on, from 1966 to round about 2012, we had only one benefit package, which is the inpatient treatment. But from 2015, the benefit package has grown in leaps and bounds to today, where we have 10 benefit packages, including specialized surgeries, overseas treatment, renal dialysis, and many others that we do administer.
All right. Now, we'll be coming to actually pick up on that particular point, looking at those packages. Again, we welcome you to be part of this conversation. This is all about UHC, understanding it, questioning it, and consequently embracing it as a Kenyan, as it is a right to receive medical services at any point in this country. So we're going to take a very quick breather. We will be back to continue with this discussion. Do stay with us.